Health insurance companies disagree with your decision to visit the ER, and they refuse to pay. Here's why. In a controversial decision, health insurance giant Anthem Blue Cross Blue Shield is warning their policyholders in Georgia, Kentucky, and Missouri that patients may have to pay for their entire trips to the ER, even if they thought it was an emergency. The company developed a secret list of diagnoses that they will not pay for. The list includes chest pain associated with breathing and influenza, to name a few.
They're basically scaring patients away from the emergency department, saying that they will decide, not the emergency physician, after the fact, what is an emergency and whether or not they will pay for it.
The question is, how is a person supposed to know? What if heartburn is a heart attack or abdominal pain requires surgery? Many symptoms can be either something minor or something life-threatening. This new enforcement by Anthem also violates federal law. The prudent layperson standard, which is in the Affordable Care Act and in many states, is designed to protect Americans.
This law requires health insurance companies to pay for emergency services based on the presenting symptom, not the final diagnosis.
This means, for example, if a patient goes to the ER worried about a possible stroke, but winds up being diagnosed with a migraine, that visit was still appropriate because it could have been a stroke. The insurance company would cover that ER visit under the law. Morning Consult asked the public what they think about this. More than 2/3 oppose Anthem's policy, and more than 4 in 10 say they've delayed or avoided seeking emergency care in the past 2 years, worried about the costs of copays, coinsurance, and deductibles. Nearly half of them had their medical condition worsen as a result.
Patients want health insurance companies to stop interfering with patient-doctor relationships. Patients shouldn't diagnose themselves out of fear their insurance companies won't cover a visit to the emergency department.
If you think you have the symptoms of a medical emergency, seek emergency care immediately. For more information, please go to faircoverage.org.